World Health Organization has warned that the new COVID-19 XE variant may be more transmissible than Omicron. The variant is a combination of the original BA1 Omicron variant and its subvariant BA2. This type of combination is known as a recombinant variant. What does it all mean? To unpack it further, we're joined now by health expert Dr Uyilawal Okhuaishesuyi. Dr. Okhuaishesuyi, it's great to have you with us. He joins us from Nigeria this morning. Good morning. It's a very difficult question in terms of, the advice from governments on one hand, and this is from governments around the world and here in South Africa as well, to people not to panic, and yet the research we're seeing around this new variant, that it's even more transmissible than its subvariants.
Yes, thank you very much. The new variant that's been detected in the UK is recombinant of what you just said, A1 and B2. But however, the virus is known to change forms, and most times we have seen different strains of the COVID-19 virus to this new one, and we heard that is as fast as transmissible in all sense. But the caution that I will still say is this, that COVID-19 has come to stay with all Nigerians, all South Africans, everybody in the world. And we have had different variants ranging from the Omicron to this present one, which is a recombinant virus. What our health experts will advise is this, that we most times need to be cautious and not to caution to the air in how we live our normal lives, wearing our face masks and trying to do self-hygiene, washing our hands thoroughly, and trying to find ways of preventing it instead of spreading it around the world. Well, there's no case of it being seen in African countries for now, but definitely we're going to start hearing of the new strains in the African countries. And we hope government does well enough to try and help us call the spread of these new variants of COVID-19.
I mean, the issue, I suppose, is that there will always be new variants of COVID-19. It just depends on, what it will mean in terms of the number of infections and, of course, importantly, the number of deaths as well.
Yes, well, I think for some time now, the number of deaths have actually reduced with this COVID-19 infection, which is what we presently at the stage we are in now. Yes, in regular different ways. We're trying to do more in African countries in trying to help pay more attention to how we diagnose and find ways of checking these new viruses. Because what I feel we are deficient in Nigeria and Africa generally is basically because we do not do more research. South Africa is a little bit better than ours here because I think you pay attention to your research and find ways to check on the trending new viruses and infections generally in the world. I feel research is a part we may need to invest in, and so I would be able to table and match up with those in the UK and the United States in finding out these new viruses. And also, because of the way our labs are, we have generally thrown caution in the air because we feel like it's like a normal flu, and people get infected regularly. And because of that, we just tend to not to know the morbidity and mortality that has caused Nigerians and people generally.
Here in South Africa, our health department has been tracking the number of excess deaths happening in any given period. So we've got the official death toll from COVID-19, but then there are the excess deaths as well. And some say that, in fact, our actual deaths from COVID-19 may be 3 times higher than the official number of deaths. That tells us something as well about what you've just said, Doctor.
Yes, but even at that, presently we are having even more deaths from Lassa fever here in Nigeria, because we have about 683 deaths presently, because Lassa fever is doing more than what the COVID-19 is even doing here. So that's why we're saying they're all viruses, and we need to do more research. Yes, I agree with you that people have more statistical analysis and data as compared to our own country here in Nigeria. And I'll give kudos to you there because I think they are doing well. Yes, we know that in Nigeria we have done more lab and research places where we can do more tests also. But I think it's a time for us to improve more in investigating and tracking these new viruses as it keeps coming on. And I hope we do that soon.
Yeah, absolutely. Dr. Uyilawal Okhuaishesuyi, let me thank you for your time this morning. He joins us via our video link in Nigeria, and it's all around this new COVID-19 XC variant, believed to be more transmissible than Omicron. Doc, thanks very much indeed for your time.